Freud was very much into sex. The reason is biographical. He was a young man of 26 when he met his wife-to-be, Mina Bernays, when she was 5 years younger than him, 21. And they were waiting to be married for 4 years because the mother didn't want him. He was poor. So what did the young man do during his 4 years with the sex? Zero. So then one of the neuroses he describes in 1895 have to do with lack of sexual satisfaction. One of them is called anxiety neurosis, Angstneurose, because you don't have enough sex. And the other one, neurasthenia, is because you masturbate too much.
Sorry?
Masturbation.
Yes.
So this is what sent him on becoming aware of sexual problems. So he read the sexological books. There are many sexologists before Freud. Kraft-Ebing, Moll, Albert Moll, many. It was a growing interest in the 19th century. And the interesting thing is that his preoccupation with sex kept him recognizing the importance of depression, of melancholia, and of suicidal ideas, which waited until 1917. You know, he started writing in the early 90s, before he wrote about neurology. So, because of his preoccupation with sex, he came to say that everything comes from sex, including love and friendship. And I say, no, this is a mistake. The non-sexual love, in terms of care and concern and helping, as between mother and child, comes first. So even if you do with sexuality what Freud did, to say that even the infant can experience pleasant emotions, it still doesn't say, it's no proof that friendship comes out of homosexuality, or maternal love out of the Oedipal complex. They're independent things. It's common sense, and also what we know from life. So I had to go to the philosophers to read about love. That's what I did. Now, one of them was Max Scheler, who wrote Das Wesen der Sympathie, written in 1913. When Freud first wrote up his cases in the book on hysteria, he used the same term. He said, I cannot treat a hysteric without feeling sympathy towards the patient, and also if the patient is not intelligent enough. So sympathy in English would be fellow feeling, Mitgefühl, not just einfühlen, but to feel together with the other person. And Scheler then makes a differentiation, citing Freud, between sympathy and love. He says, sympathy is what we can feel without really getting too involved. Love is a deep relationship which implies what we call in German a Hingabe, and a kind of giving, offering yourself to the other person and having the same thing in return, And it also has to do with a perception of the other person's value. So it's not just a feeling of sexual attraction, but it's looking at the other person with all their attributes and seeing in them a worthwhile person to want and to be with. So, Wert, the value of the other person. And he even says something deeper. He says, in every perception, there is an element of also becoming aware of the worth of the object, of the other person. That it's not just looking, but becoming aware of the total worth. Now this idea was then adopted by Pope John Paul when he was a bishop in Krakow, but with the name of Wojtyła. And in 1962 he wrote a book, Love and Responsibility. And when I visited Poland in '88, I got that book as a gift and came home and I said, it's an amazing book. Because the man cites Freud on sexuality and talks about infantile sexuality, but at the same time it uses the concept of Shaler about the worth of the other person and how important that is. So one day I wrote to the Vatican and I said, I'd like to translate your book into English. So I got a letter from the secretary. He says, thank you very much, the book has already been translated, but His Holiness has you in his prayers. That was a very lovely gesture.
What's the name of the book?
Love and Responsibility.
Entrance.
Yeah, it's in English.
It's surely also in German.
Yes, yes.
Yeah. So, in that book he also talks about the dramatic sense of life. So, I was confirmed by some other authorities, and also by a Catholic priest who was active in Krakow by the name of Josef Tischner. He is translated into German. I saw it, the German translation of it. It came out in 1989. Tischner, so probably some German roots there too. But he calls it phenomenology and goes back to Heidegger. And I don't like Heidegger. Especially nowadays with his diaries that came out, right? And the other reason is because Scheler wrote about it before him, before Heidegger. Heidegger wrote his book in 1927, Sein und Zeit. Also he made a mistake, Tischner. He said that the whole idea of phenomenology and intentionality comes from Husserl.
From?
Husserl. Edmund Husserl was a Viennese philosopher who then became Heidegger's teacher. But it's not so. It came much earlier from another Viennese called Franz Brentano. Brentano talked about the connection between the person and an object, and that connection is always carries an intention, which also is in some ways connected to worth. That we always approach something intentionally because it arouses our interest. Now, Aristophanes talks about friendship. And when it comes to non-sexual love, friendship is an important part of it. That word is philia. So it's love in the non-sexual sense. We love something because it represents beauty or a deep thought or something of a moral kind, has a moral virtue. So that kind of love is philia. In the Christian tradition, it was called agape, and later on caritas. So again, the non-sexual element is important in understanding the nature of sympathy and the nature of love. So, so far the gist of the message. Now is the elucidation of the positive aspect of love, which is altruism, and its opposite, egoism. And here I read Erich Fromm, The Art of Loving. You know the book?
Yes.
All right. So we are on familiar ground now. And Erich Fromm made this important point. He goes back to the biblical, love your neighbor as yourself. And then he asks the question, why is loving oneself a criterion or being able to love somebody else? Yeah? And he comes to this conclusion that if you cannot love yourself, you cannot love anybody else. Right?
What is love for?
So he said, self-love is not the same as egoism or narcissism. It is a natural and necessary ability, or else you will not be able to love anybody else. So he says the egoist doesn't love anybody and doesn't love himself either. So this is also an important idea to understand the positive nature of self-love. Now, there was one German thinker named Max Stirner. Have you heard about him?
No.
Max Stirner.
Stiller.
Stirner. Der Einzigen und sein Eigentum. And he was a most extreme egoist. He said, I don't care about anybody. I only care about myself. So you can go to such extremes. Or maybe he wasn't as bad as he wrote, but this was his philosophical position. And he was quite influential for a while in German philosophy. And he may have influenced Nietzsche as well. So then there are the other negative emotions of jealousy, of envy, and of course of aggression and anger and destruction, which are all love's antagonists. As far as addiction are concerned, I would say the addict has many qualities of selfishness, of egoism.
Selfish.
Selfish.
Self-love.
Yeah.
Love for himself.
Eigensinnig, no? So the addict only cares about his own drugs. He doesn't care about what effect they have on others, right? Isn't this the common experience? And also, I think, in connection with that, he doesn't love himself either. The drug taker doesn't love himself. The selfish behavior is only selfish, but it is not genuine self-love or self-appreciation. Wouldn't you say?
I'm not sure if it's true.
But I like to I don't know. I'm asking you now.
Sometimes I'm impressed how much the addicts can love.
Okay.
Other addicts and their parents, and they're suffering from their addiction, and they don't like to destroy the whole family and the whole life, yeah?
Okay, then I'm happy to hear that they are such, but aren't they also the other kind of those who are selfish and don't care about anybody else?
Yes,
think-
also.
Yeah.
Also.
But sometimes, the addiction itself
Yeah.
make them to appear like that.
Yes,
You
they are
know,
forced.
Yes, and then, if you treat the addiction, you can see the real person after that.
Mm. Okay.
But, also like, you may have like, even like pre-addiction personality problems.
Yeah,
And then
yeah.
you add addiction, and then, you can see the extreme you're talking about.
Mm-hmm.
I think we must separate the consumer, no addict, from the one that is addict. The one that is addict is a suffering in withdrawal. So we are talking about a patient.
Yeah.
The one that is not addict, it's a consumer,
Mm-hmm.
not addict. It's a risk behavior, but it's not a patient.
Right.
It's somebody with a risk behavior, or Dalek behavior if you want.
Well, then we should say that the fact of taking drugs is not a disease. It's
Yes.
not even a crime,
Yeah.
Yes.
and it should not be a crime.
Yes.
This is the hypocrisy of our times.
Yeah.
The effects of the drug are pathological. But then, what I would also like to hear your opinion about.
Not automatically.
Huh?
Not automatically.
No, no. But I'll say now, to me, the common denominator of illness is trauma. This was a Freud first discovery.
Yeah.
There's no disorder without trauma. There has to be something that caused great pain to that person at some point in their life. Some dramatic episode or some chronic exposure. But the issue of pain is an essential aspect of addiction in one form or another, because they take the drug as an anesthetic. Would you agree?
Even addiction without substances.
Yeah,
That's the point.
yeah,
Even without drugs.
right.
The point.
So there are different ways of relieving the pain. There are psychological means, and there are pharmacological means. So you can either forget or repress or find another defense, anything to quiet the pain. Or you take alcohol or drugs. Now, most people that come to doctors and complain of pain have no organic disease. The vast majority of people who come to the doctor and say, "Doctor, it hurts me here," nothing is here. There's only a muscular contraction, sitting wrong, making some effort, or translating anxiety into muscular spasms. So, for example, what's the word in German? When you feel anxiety.
Yes.
There's a special word, Brust something.
Beklemmung.
Beklemmung.
Verklemmung or Engbrüstigkeit. Right?
Ja, dann weiß man auch, was es ist.
Yeah? It's an older word, but
Yes.
it's still understood. When you get something here. So they say, "Oh, it's my heart," or "the heart is fine." Or something affecting their breathing. So people come to doctors and say, "It hurts me," and doctors, "Oh, it's some kind, you have this disease, you have fibromyalgia."
Yes.
And they start giving you drug after drug, including steroids. And it's a phony disease. So I would say many addicts become addicts because of this kind of pain,
Iatrogenic.
iatrogenic over-medication, and then now the editor of Psychiatry Times says, oh, now I admit that because of overuse of opioids to relieve pain, people became addicts to heroin. So this is why I say trauma and pain are the important causes before the addiction develops. Not in everybody, but it's a matter of all kinds of accidents or all kinds of fortuitous encounters, and bingo, and you're hooked. Like a fish on a hook.
So how do you treat them in psychotherapy?
Like in every other psychotherapy, you try to understand,
So you go to the core of the trauma.
to find the historical trauma and to see is it still effective, is it still playing a role in their behavior today. Say if they develop a certain character trait to deal with the trauma and they're acting it out on the job or with family members. As I said, in the case that I briefly mentioned, this young man was hounded by his past and by his unhappy family life. So I don't remember how he got to use cocaine, but he used it regularly. And working with him in psychotherapy opened the door to other possibilities, and he gave it up. Because he wanted to give it up. Now, add to it not only the poisoning of the brain, but also the hangover, which is a real suffering.
I think the challenge for us as addictionists is the kind of psychotherapy we use is is kind of different because the patient selection. So your patient, it seemed that he was psychologically minded and he was interested to learn about himself. And then you work with him to go to the core of the problem and to resolve it. The population we see in our clinics, it's not all of them are like that.
No. Not only this, most of them are also very poor.
Yes.
And they cannot afford good therapy. So I would say poverty is one of the reasons for psychiatrists and others taking distance. See, it takes somebody, I would say, you who are working with addiction, sacrificing yourself for the benefit of helping them without much financial compensation.
Yes.
So it's almost like a monastic calling, right? It's a vocation. You want to help somebody suffering. It doesn't mean that they are willing and ready or able to accept that help. Many of them cannot. That's also the tragedy of the profession, right? But this is nothing we can do about that. Freud said that there are two impossible professions, education and psychoanalysis. And in both cases, we need a good student or somebody willing to learn. Now, in dramatology, I also developed an idea of active confrontation. I have this woman with whom I've worked for 15 years. She never got married, and she always picked worthless men, going back to worth, because in her grandiosity, she was saving them from themselves and being their therapist. So of course they would use her but gave her nothing in return. But also she was unable to, she didn't believe she's worth much herself. And in therapy, she tried to get me to love her, but also made all kinds of tricks, like tell me stories, and I learned from one German philosopher, maybe you heard of him, Paulsen, 19th century. He said it's very important to tell the truth. And I have a musical ear for somebody who is not telling the truth. You can tell. So then I used confrontation. I said, you're lying to me. This is not considered analytic. But I think this is a technique that has to be used. To confront the patient if they're lying to your face. And now, after many years, it is giving you results. She was always coming in with a prepared speech. And I said, that's not the idea. The idea is to come here and talk spontaneously, because that's where the memory is. No, she comes in with a report, with a reportage, with a story. The drama is right here. So, in the drama too, there is a certain lie in the protagonist, and then the truth comes out, which is the crisis of the play, right? What do you think, Luís?
I'm thinking about acting out,
Yeah,
impulsivity, and psychodrama.
yeah, also dramatic, right?
The fence is broken.
Yeah. And also the word that Freud used, you remember, Breuer used tragieren, and Freud used agieren, to act out. And he said, oh, agieren is bad, because the patient doesn't remember. No, that's not true either. Agieren is a way of remembering through acting. Therefore, you have to analyze the acting out to understand what's behind it. Because the acting out is also communication. Right?
I'm trying to do it.
Yes. Did you agree this morning to my words about trust between?
Absolutely.
Yeah.
That's why I called you a psychotherapist. I would say any doctor who deals with patients over a long time has to use some kind of psychotherapy.
Yes.
Has to. Because
But I see worldwide we make so many mistakes in this point.
yeah,
Yeah, we have all over the world. We have our regulations are full of mistrust, and we are forced to keep a mistrusting relationship to our patients for years, yeah, for lifelong. Yeah, it's nearly impossible.
yeah.
And many doctors in Germany, one consequence is you are nearly not allowed to prescribe it for take home, the medication. Yeah, they have to take it in front of you, and this is a sign of mistrust.
Of course.
Yeah? And
Not only mistrust, suspiciousness.
yes, and the doctors earn much more money. Each patient who drinks in front of you, the doctors earns €5. Yeah, yeah. So the doctors have all the arguments for you are not able for take home. Yeah.
Yeah,
Yeah.
because he makes money on it.
Yes.
Yeah.
And, this is
I'll tell you another story.
it's really terrible.
Psychiatry has also gone down in America. A couple of years ago, they interviewed a psychiatrist who used to do the usual psychotherapy. Then he said, I've decided to change my practice. I see 4 patients in an hour, 15 minutes each. I give them only drugs. And when they want to talk to me about themselves, I say, no talking,
No time.
go to my wife. And then he charges 4 full sessions.
Psychologist.
No, an MD.
And the wife is a psychologist?
Yeah, social worker, psychologist. Yeah. And it was written up in the New York Times. So that's also cheating, right?
Yeah.
Yes.
So it's not just mistrust, it's cheating and lying.
What is cheating?
Between,
Yes.
yeah, cheating and lying.
Yes.
So the patient knows that.
Yes.
The patients know us as well as we know them.
Yes.
And you can say with the drug addict or schizophrenic, if you lie to them once, it's finished. Because it's early trauma, somebody lied to them before and hurt them. And if we repeat that, it cannot go on. So we have to be honest all the time. All the time. There's no room for any, even the smallest lie or pretense.
Even the failure of education,
Yeah.
talking about non-substance dependence, addiction, even shopping, even gambling, even internet and all the facilities that, the possibilities that internet allowed, like a big road. And the antidepressant behavior, the anxiety, people try to get with this kind of new behavior. What do you think about trying to rebuild something or to replace something that isn't there?
Yes. The whole thing now is that the drug industry in America is very powerful.
What is very powerful?
The drug industry.
Yes.
Medical.
Yes.
And you see, in American, the word drug is used for medications and for addiction.
It's a shame. It's a shame.
But in a way, it's also reflects a certain truth. Because I would say there is a white drug and a black drug, like the white mafia and the black mafia. So, but the word dependence reminds me of another topic. In Polish, you say dependence is one word, and then the same root changed in a somewhat different form means addiction. So dependence is zależność, and addiction is uzależnienie. In English, there's only one word, dependence and drug dependence. Okay? Now, what is forgotten here is interdependence. Interdependence means that the patient needs us and we need him. Dependence is usually one-sided. More like, right?
Both sides.
So, interdependence should be remembered. And this is why it started with mother and child. That between them is interdependence. She needs the child and the child needs her. That's why I said it's the model for the therapeutic relationship with its maternal qualities. It has nothing to do with gender, it has to do with taking care, which is also the father's and the mother's duty, both, in different ways. This is why I said the mother teaches the child love and language before anybody else. And that learning is essential because we have the Broca area in the left brain, which is the speech center. But if the speech center is not aroused in time by a mother who teaches the child language, the child will never speak. Right? That's what Luís told me too. So, I would say the same is true of sexuality. There is a certain Anlage, an organic ability to experience sex, but somebody has to awaken it. And the history of how it's awakened then becomes the sexual habit of the person. The first impressions are so strong. So it's who introduces you into it. Who is your teacher in love and language and sex?
It's wonderful.
Thank you so much.
And thank you for being here with us.
Now at best.
Good night.
Wonderful to meet you also.
See you tomorrow, right?
Yeah, we
Thank you, Henry.
Traveling together at 11 o'clock.